Hello and good evening, everyone. I'm Dr. Srinivas Chilukuri, a senior consultant radiation oncologist from Apollo Proton Cancer Center. 17th of June was World Kidney Cancer Day. What does that mean? I've already mentioned to you that World Kidney Cancer Day is an occasion for us to learn more about kidney cancers, to talk about them, and to share information and knowledge about kidney cancers. And we have had interaction with three leading Uro oncologists so far. What have we learned? We have learned that fortunately, kidney cancers are not so common, but it is very important for us to learn about these disease. It is known that most of these patients are being diagnosed now in asymptomatic stage when they do not have any symptoms, any signs of kidney cancers, only detected on a master health screening checkup. Blood in urine is the most important symptom. Dr. Raghavan and later Dr. Sanjay told us that nearly 1 out of 4 persons who have blood in urine could have a cancer. So it is an important symptom and it must be notified to your doctor, brought to the attention of the doctor. We've also learned about risk factors, and there are three major risk factors for kidney cancers. One is a smoking, two is obesity, three is hypertension. The good news is all of them are avoidable risk factors. Apart from these three, there are certain genetic factors which could play a role in causation of renal cell cancers or kidney cancers. To learn more about the treatment aspects, we have one more prominent Uro oncologist of the country, Dr. Indraneel Banerjee, who is a Uro oncologist in Apollo Hospitals, Kolkata. Welcome, Dr. Indraneel.
Thank you, Dr. Srinivas. Good afternoon. Thank
Good
you for the
afternoon.
kind introduction.
Pleasure to have you. So, we've learned so far that the cancers can be detected on a simple ultrasound. They can be picked up on an ultrasound. They can be further tested through more imaging, either through a CT scan or MRI and certain blood tests. And once we know that there is an index of suspicion, we also learned from the previous speaker that we don't have to do biopsy in all patients. In fact, most patients must not be subjected to biopsy. We also learned that some patients could even be observed. That means we don't have to intervene immediately. And Dr. Sanjay also told us that some types of kidney cancers are indeed very good. That means they have high cure rates, they behave very well. So, coming to the treatment aspects, if we see a lump in the kidney, now that we have been told that you should not do a biopsy, can we go in and remove the lump or the tumor, or do we have to remove the entire kidney?
It all depends upon the location where the tumor is and also depends upon the size of the tumor. If it is a very big tumor that is involving the whole of the kidney, 10 centimeter, 15 centimeter, then probably you won't be able to save the kidney. But if it is a smaller tumor, 4 centimeter, even in experienced hands, if it is 7 centimeter located in the lower part of the kidney, then obviously you can just take out the lump and preserve the kidney. That way, you can preserve the kidney function also. So, yes, we can obviously preserve the kidneys by just removing the lump, but it depends upon the size and the location. There's a reason, as Raghavan mentioned yesterday, that we have to catch these tumors early when it is still small and we can only remove the tumor and preserve the kidney.
So, to summarize what you just said, in most situations you could preserve the kidney, and I want you to emphasize again that if we preserve the kidney, if say we preserve 1/4 of a kidney, can still that kidney function normally?
Yeah, that will function normally because if you, it has been seen for kidney tumor patients that from the beginning, in one-fourth of the patient will have some kidney dysfunction. So if you remove the whole kidney when you could have saved it, then they will end up into kidney failure later on dialysis. And if the patients have kidney failure, will have heart problems in the future. So the target should be to preserve the kidney at any cost if possible. But having said that, we shouldn't compromise on the cancer outcome also. So we have to do the surgery when it is really needed, when you are able to remove the whole tumor.
So, can you also tell us for the viewers that, of course, there are two kidneys in the body in most patients, most people. So, if for God forbid, you will have to remove the entire kidney. So, how does the patient live?
So if we remove the whole kidney, you have one kidney. If you see the donor patients, they donate one kidney and they live rest of their life normally with only single kidney. A lot of people are born with single kidney. So if you have only one kidney, which is normal, functioning well, then you are going to live a normal life.
Fantastic. So I think, viewers, it is very important to understand that one could lead a normal life with single kidney. But having said that, in most situations, as Dr. Indraneel mentioned, that you could get away removing only the tumor and preserving the kidney. Dr. Indraneel, can you tell us what are the advances in the field of kidney surgery in the past few years?
So as you know, for the kidney cancer, if it's still in the kidneys, the mainstay of management is surgery. For surgery, traditional, you open the patient up, take the tumor out, or take the whole kidney out. That's a traditional surgery. But over the years, we have graduated from open surgery to minimally invasive. Minimally invasives are laparoscopy or robotics. Laparoscopy, with 30 years old, robotics, still more than 15 years old. So, if you do laparoscopy or robotics, what are the advantages? Less pain, less blood loss, less chance of blood transfusion, and patient can join work early, and length of stay in the hospital will also be less. So, and from laparoscopy we have graduated to robotics now, so that is a cutting edge technology. Why robotics? If we are planning to preserve the kidney, that is a partial nephrectomy, partially removing the tumor, partially removing the kidney and only the tumor and preserving the kidney, then robots wins over laparoscopy, because in partial, you have to clamp the artery that supplies the kidney, and in robots, it's more precise, more fast. You have to once you take the tumor out, then you have to repair that area, so it's much faster and much ergonomics is there. So that way, robots wins over laparoscopy for trying to preserve the kidneys. So that way, technology has changed from open, then laparoscopy, then robots. But there are situations where you cannot do laparoscopy robots, very huge tumor, then you have to go for open surgery. Yes.
Dr. Indranil, robotic surgery seems very, very fascinating, and we have seen the applications of robotic in the field of genitourinary tumors, be it kidney tumors, prostate tumors,
Mhm.
and even bladder tumors. There is a big spurt in the use of robotics. Can you elaborate for an average viewer what exactly is robotic surgery and how is it done?
So to answer the question, I'm happy that you asked that question. To answer that question, the most important thing is to know that we have to bust some myths. First thing is everybody will think, a lot of patients will think that robot does the surgery, which is not, which I will explain you in a minute. The next one is robot is much more costly. Upfront cost is more, but the patient goes home after a complete removal next day, after partial removal within 2 days in kidney surgeries. So our patients can join work within 7 days. If you're doing work from home in laptop, they can just start work within 7 days. So these are the advantage of robots. And so if you see in the long term, in 1 year, 2 years time, from the day of surgery, robots becomes more cost effective as compared to open surgery, because open surgery patient will be in the hospital maybe for 4 or 5 days because of the pain, because of the incision, blood loss, all those problems. And to understand how the robot works, I have a beautiful model. I will show it to you right now. So this is how a robotic OR looks like. This is the robot. It has four arms, one, two, three, four. Patient lies here in the OT table or OR table, what we call it. And you see, this is the surgeon. This is the surgeon's console. Surgeon will be sitting here doing the surgery. Surgeon assistant will sit here by the side of the patient and look at the monitor, which is known as the vision card. This is the patient card of the robot, and this is the console. So it has three components. Surgeon operates here, continuously communicating with the assistant, and the robot will move as per the surgeon's advice. So it is master slave system. Robot is a slave. Surgeon operates and the robot moves that way. Now, the advantages are with such a small arms, you can reach to those areas whether the human arms or human hands cannot reach. And no tremor, more precision. For the surgeon, there will be more magnified vision and 3D vision. So all those advantages are there which are not there in open or laparoscopic surgery. And for the patient, as I've already mentioned, patient goes home faster, less blood loss, less chance of blood transfusion, less pain, less analgesic requirement. So better for the patients also. And in the longer run, if you see, it is also more cost effective.
So sounds fantastic and wonderful, Dr. Indraneel. Uh, as to just again to summarize, you mentioned that for patients at least, the length of stay is shorter, the blood loss is less, the recovery time is faster. So, what would be an average length of stay in the hospital for the patient, and how soon the patient can say walk or go for a jog or start working after say a robotic partial nephrectomy?
Yeah, if it's a robotic partial, patient can go home within 2 days. And partials are a little bit challenging surgery because you cut through the kidney, there is always a chance of bleeding. So we usually recommend the patient to avoid heavy exercises, jogging for a month. But after that, he can do whatever heavy exercises, jogging can be done after 4 weeks. And even if you have a robotic surgery, smaller incision, less pain, less blood loss, then they can, at least I have already mentioned, they can start walking from home within 4 5 days after the discharge. But yes, for heavy work, they should avoid it for a month for partial because it's a complex surgery. But if you are removing the whole kidney out, most of the patient can go home next day. So because it is less complex surgery, and again, there'll be a small incision, so they have to wait for a month's time before they can go for exercises and jogging.
So, previous speaker, Dr. Sanjay, mentioned to us that there are different types of kidney cancers, and there are some which are very good and very high cure rates. But on an average, for just to understand about kidney cancers, how good or bad are kidney cancers, say, compared to, say, a breast cancer or a lung cancer or any other types of cancers? How good or bad they are? What is the cure rate for kidney cancers?
Again, when we are going to catch it, if we catch it early, cure is very high. We catch it in first stage, tumors are very small, the cure rate will be somewhere 85 to 90-95%. And then becomes a bit larger. Second stage, when we have to remove the whole kidney out, the survival, the cure rate comes down to 75-80%. But when it's going out to the vein or other parts of the body, lung, nodes, glands, then survival dips down to 15%. So that's the reason we have to catch it early, try to preserve the kidney, and that's the most important part of this awareness. The patient needs to know, as my previous speakers have mentioned, blood in urine, go and see a neurologist, get yourself evaluated, get a CAT scan, and then once it is diagnosed, don't waste your time. You can be completely cured, and your kidneys can be saved.
So, is it possible for patients, say, because Dr. Sanjay mentioned that some cancers could be even be observed, but if you continue to observe them, will they end up requiring removal of the entire kidney instead of a small portion of the kidney? Is it such a fear needs? Is it
No, no,
something that
not
is a
not
valid
really.
fear?
That is the concept of active surveillance or actively monitoring this patient. Still, the stage comes, then you need to offer it. So obviously, Dr. Sanjay has mentioned, then you can do this upcoming thing. You can monitor these patients when it is needed. Then you can definitely go for partial or just preserving the kidney and remove the tumor out. So yeah, that can be done.
So Dr. Indraneel, I will summarize what you just told us, that uh, kidney cancer has got very high cure rate, especially when detected early. You mentioned that surgery for kidney cancer, a lot of patients do not require a entire removal of entire kidney. Most of the patients can undergo a partial surgery, which will preserve their kidney and kidney function. And you also mentioned, and very, very clearly, that patient can survive and lead a normal life even with one single kidney. You also mentioned that there are minimally invasive approaches to remove the small portion of the kidney or the tumor, either through something called laparoscopic or robotic techniques. You also mentioned that with laparoscopy and robotics, the blood loss is less. The length of stay, that means patients staying in the hospital and getting discharged, is very quick. The recovery time is quick. Coming back to full recovery is extremely quick with the modern advanced surgical techniques. Would you like to add anything else for the viewers to know on this occasion of World Kidney Cancer Day?
Other thing I think we can just touch upon is if the patients are not fit for surgery, do you have any other option? Yes, there are few options where you can freeze the tumor or you can ablate the tumor using different kind of rays or microwave energy. And you are the better person to answer. There are also role for radiation in some of the tumors which are not amenable to surgery. The patients who are not amenable fit for surgery. These are the options what we have.
Since you touched upon it, I would just like to mention that as a radiation oncologist, we do see a very small, extremely small percentage of patients whom our surgeon colleagues refer to us because the patient is very old or fragile or multiple medical problems, because of which the surgery becomes risky, the anesthesia becomes risky, although these days those patients are getting fewer and fewer. But in those situations, radiation does play a role wherein we could achieve high amount of tumor control while maintaining the normal kidney function. So, with
Yes.
that, Dr. Indranil, thank you so much for imparting this information, giving this information to all of the viewers. And we will have another exciting session regarding multidisciplinary approach and the role of systemic therapy in kidney cancers tomorrow. Thank you so much, Dr. Indranil.
Thank you. Bye bye.
Bye.